Thank you so much. And what I'd like to do now is to invite our patient and caregiver to join us on the stage. We have Mark and Alicia Aguirre who are joining us from the area, and they're here to share with us some of their experiences. So again, thank you for being here with us today. And I'd like to start the panel, if you don't mind, just introducing yourself and telling us about how you were diagnosed and some of your experiences at the very beginning.
Thank you, Mary Margaret. My name is Mark. I'm 52 years old. I want to first thank Debbie's Dream. This has been very enlightening. Thank you to the doctor panel. I wish that I had known about this and I could have coordinated more in advance a lot of my chemotherapy friends to come and attend, because it's been very valuable, especially in my situation. This is my wife and caregiver of 23 years, Alicia. So just to back brief a little bit on myself and my situation was that about 4 years and a half ago, I was deployed overseas, and when I came back, in hindsight, I did have some symptoms of something like just bloating. I thought maybe I had like reflux. And so when I came back stateside, I went to see a doctor, a primary physician, and he said everything checked out, no problem. But I continued to have, these symptoms of what I thought was not a big deal. And then I went to another primary physician, and pretty much he just said, make sure you take the Prilosec, And I said, it's not working. Eventually he goes, all right, let's check, make sure everything's okay. Let's do the endoscopy, colonoscopy. At your age, you're a little overdue, so let's do that. And so I went to my gastroenterologist, great doctor, very good line of communication, felt really at ease. So did the test and everything, and I'm pretty much what I consider a regular guy. One thing I really value is straight talk. And he came to me and said, I'll never forget his words. He goes, I don't know how to tell you this, so I'm just going to say it. You have a tumor, and I believe it's cancer. And I'm going to send you to an oncologist, and he's going to put you on a path. So those were, immediate shock. I was like, wow, what did you just say? I've never even thought of those types of things. I was just overwhelmed was the best way to describe it. And my wife was there with me, so she's been rock solid for me, and that was a huge sense of support. So then from right there, anxiety started building up. I was just, okay, what does he mean by he's going to put me on a path? What does all that mean? Initially, all I expected was my oncologist to call me in a couple days. Those were the longest couple days I've had, and the call didn't come, made it even worse. So I relied on my wife, and I said, hey, let's try to see if we can get a response from the oncology department, and so we can at least get some answers, questions, consulting. We got a lot of doubts. So we ended up contacting them and got everything on path. And I try to always see the other side of the coin, see where the doctor's perspective is. And I understand that there's a lot of things that they can't tell me, a lot of things they can't promise. They don't want to tell me something that's not going to turn out or give me false hopes, those types of things. So I try to understand that. But at the time, I was just kind of like, what's going to happen is stage 4. Adenocarcinoma, is that how you say it? Okay. And so, still foreign language to me, not understanding the whole thing. Stage 4, okay, I know it's bad. But my gastroenterologist, when he called me personally right after he got the results, and he said, yeah, it's spread to your liver. There's a couple spots on your liver and stuff like that. So I knew that was bad. So then we went to the oncologist, and it was just I was just overwhelmed with a lot of questions, and it was difficult for me to leave there satisfied, because I wasn't clear on what my path was. That's what I was expecting. I just need, define that path for me, and I'll follow it. Let's go. Let's do this. I left with a lot of thoughts, thinking that I'm going to die soon. I don't even know when it's going to happen. It could happen next week. It could happen soon. So all of that, just to kind of say that the next phase was mostly worrying about my family, worrying about my folks. My mom was also very ill at the time, so a lot of things were kind of taken over as a wave, and so then we finally did get on the path with the oncologist, started the chemotherapy, realized I wasn't alone, started making friends at where we go get our treatment on a weekly basis. What helped me a lot was seeing those folks' attitude, fighters, a lot of them, younger, some older, but none of them had a bad attitude. And you could see their support systems there with them, and it gave me a lot of hope. I'm still at this point trying to not slip back into denial. That was a tough one. A lot of me kept saying, I feel fine. I don't feel like I'm sick. My friends tell me that I look fine. Maybe I can just pretend that this isn't happening and everything will be okay. So I have to constantly pull myself out of there and say, we got to stay focused on this fight and see, where we're going to go. Expect the unexpected, but also a lot of what Mary Margaret mentioned as far as how your kind of process goes as emotionally is very true. You just start taking into consideration a lot of things. But so that's kind of where we're at right now. I know the stronger part of the story, the more fortifying is what my wife has had to go through, because she has her career. She's had to give up a lot to help me, just to go to my treatment and help translate a lot of the medical terms for me, because there's a lot of stuff I just never thought about. I'm just trying to read about, and I'm trying to get educated, but there's just so advanced all the time. A lot of what I heard today I'd never heard before. Gave me a lot of ideas, a lot of talking points from my oncologist. A lot of what I've read incorporates alternative therapies. I know I've mentioned a couple to my oncologist, and he's just like, nope, just stay focused. And I understand that the chemotherapy is mandatory, is my best chance. I totally understand that, but I've also always tried to keep my mind open and see if there's other things that it can at least make me feel better or make me healthier, those types of things. But that's pretty much where I am right now. I'm 23 years in federal service. I'm ready to retire here in the next couple of months and focus on the important things, being around my family and trying to just get things arranged and continue this fight along the side of my family and wife. But I'll give the floor to my wife here so she can share a little bit more in detail of the specifics regarding all the medical stuff and the support she's given.
So I'm Alicia. I'm Mark's wife of 24 years. This diagnosis really sideswiped us, to say the very least. We anticipated with his the procedure he went through, the endoscopy, colonoscopy, we were anticipating colon cancer, really, because his mother had had colon cancer, and that's what your mind naturally goes to. That was this concern. And so when the endo came back as positive, you have a grapefruit sitting in your stomach. That causes you to, literally, and pardon the pun, it was a kick in the gut for me, and I'm definitely for him. He had rapid weight loss. I went away for training for 2.5 months. Our daughter took over in my place during that time. While we were getting, I refer to it as a steamroller, to get his medical care sort of moving forward, getting his port placed, making sure he had, for his first treatment, he ended up having a PICC line installed, and then the port was put in later, just because of timing. The timing thing, it just seemed like, it really felt like I was, lifting the largest rock ever, making a lot of phone calls. And I had to learn early on that I was his advocate. And I consulted with, I looked at my network of people I know. Nurse, if you have nursing friends, doctor friends, ask them questions. I knew nothing about this disease. We knew nothing about this disease, and we have had to learn on the fly what's going on. He will be getting ready. He's gone through 6 treatments, and they're working. We know they're working because his CEA number, which is the tumor marker number, are trending downward. He goes for a rescan next Friday, and we're hoping for official restaging and expecting it. And that's where we are with all of this.
If I could add one last thing, is that when I was told stage 4, I felt like it was like a removal from, like a separation from everybody else that's been diagnosed with cancer. You're like in a separate category. So that kind of made me feel even more isolated. It was tougher to handle then, because first I had to figure out what that meant. Secondly, I started realizing, okay, so what he's telling me is that there's no win here for you. So kind of you're in this other area here. I felt like 1 through 3 was the more successful part for them. So at the oncologist, and that you're kind of separate here. I'm not really gonna talk about surgery, talk about any kind of hope, anything that you could maybe look forward to. And I think that was the toughest there. But I do chalk that up to more my lack of knowledge and miscommunication at that level, where I started to learn a little bit more. This has been, like I mentioned, so enlightening for me, and I'm definitely leaving here more, knowledgeable on the topic, leaving with more hope, and leaving with a lot more talking points to share with my primary caregiver and my oncologist, and it gives me a lot of strength to continue forward with this. So I definitely will recommend the website, the foundation, to all of my friends at the oncologist's office, and there's so many resources on that website that I saw that are gonna hit the nail on the head for a lot of us, just to get on that track and realize that there's light at the end of the tunnel in any event. But I just wanted to reiterate thanks for that, and thank you very much, and I definitely will be moving forward with supporting the foundation.
Thank you. And thank you for sharing that. Would you mind sharing, I know, Alicia, you and I spoke prior to today about some of the specific challenges that you've had, and I know that some of it related to communication and timing and getting things started. I don't know if you could speak to that in a little bit more detail in terms of what the challenges were and what steps did you take to overcome them? And Mark, I'm going to ask you the same question.
So for me, some of the challenges in the very beginning, it was communication with the offices, front office in particular. There were changing of guard, so to speak, people taking, time off, and the passing of the baton wasn't communicated, in my opinion, very well. Just making sure, I knew, like Mark referenced before, we're pretty straight shooters. Like, if you give me a punch list of things I need to do, I'm going to do them. But when it's like very vague and not communicated very well, and everything was on the phone or in person, having something that you can disseminate via email, because let's be honest, we live in a technology world, but some of this stuff is not like moving over, and you're not communicating directly with your patient via email or via the patient portal, because we do have a patient portal, but it's not utilized, in my opinion, very efficiently. Mm-hmm. So that was one of the things, and making sure, being accountable, because I'm going to be held accountable for what I'm able to complete regarding his care, as far as scheduling appointments, making sure we're on time, making sure he's taking his medications appropriately, and making sure he's understanding in layman's terms what they're really saying. So that was probably one of the largest ones, and it was trying to make sure he got his PICC line installed. He was scheduled for chemo, but yet there was no PICC line installation, which was their responsibility. And so that was a huge oversight. But once we got that steamroller, that rock head propulsing forward, things started to, they've gotten decreasingly better. Everything is moving more like a well-oiled engine. We're getting educated on what we should know, what we should ask, and so we know how to proceed forward with having hope, because there is hope.
So on my part, I'll just add on to what she mentioned. That's the biggest challenge was, I forgot to mention that we live in southern Washington, so we're in the Vancouver area. And it seems like what we've had to do is kind of, put different pieces together all over. And the doctor panels mentioned it in their talks was, it's not as comprehensive in the more rural areas, whereas it is here in the Seattle metropolitan. So I did get a second opinion because I wasn't happy at the time with what the diagnosis was. I came to Seattle and got a second opinion and basically was told what the doctors just mentioned. Yeah, we could do the treatment here, but I've reviewed what the diagnosis is. I've seen the treatment. I'll be doing the same thing. You can do it at home where it's close by, or you can drive up here. I don't mind doing it for you. It's just kind of your personal decision. The doctor I spoke to in Seattle was very straightforward, which I completely respected, and let me know. And it's tough to hear, but I felt better. I felt better after hearing that. And then he helped me make my decision, and I decided, okay, yeah, I see what he's saying now, because it wasn't put to me in those terms of, look, it's pretty basic. This is what you're gonna do either here or there. So make your decision based on what you have in front of you. And so that's what we decided right now. I think once a reassessment is made and we have options for moving forward, we probably will consider coming to the Seattle metropolitan area and finding something more comprehensive. To me, the model of comprehensive services or resources has been the website of Debbie's Dreams. So it's a good starting point to kind of just guide us into the next phase of this and more specialized services where we're not kind of just like trying to piece together, the different help that we had over there, and rather just kind of group it all together. I think especially for me, with being so, not knowledgeable on the subject, that would be something that would be very helpful, is to kind of just have a flow, maybe like Dr. Zeng mentioned, if I wasn't stage 4, meet with a group of doctors that I'll kind of have equities in my situation, and just get it clear from all of them what's next and how do we go about this. But that I would say was the biggest challenge for us.
Mm-hmm. Thank you. Alicia, you had mentioned that there were some specific questions that you needed to ask to help kind of move things forward. Like maybe it was something that you had asked of your doctor to inform you on what to do next. Do you mind off the cuff sharing any of those?
Sure. So I asked the question because, one, it's a question that Debbie's Dream Foundation asks, because the form you fill out, because I literally, we got his diagnosis on was it Tuesday or Wednesday? It was midweek. And I literally, like, that night or the following morning, I was on the website or Googling, like, this is what came up. So I'm going to this form and I'm like, H. pylori. What in the heck is H. pylori? We don't know anything about this. So then I start Googling about that, and then, one of his appointments, I'm like, hey, have you screened him? Do we know? And he said, you don't need to worry about that. And I'm like, no, answer the question. It's yes or no. Mm-hmm. And I still haven't gotten an answer. And that's been a little frustrating. Mm-hmm. But he doesn't want to focus on that. And then I'm not sure if there was another question that we've asked. Oh, there was an alternative therapy he had inquired about, and it was sort of like, it's folklore, don't worry about it. Mm-hmm. And whereas I've had other friends who have gone through chemotherapy and their doctors are like, sure, it's not going to hurt anything. It might help. And so we had the opposite response. So, but there wasn't, like Mark was saying earlier, communication. Like this could have opened up a line of communication where we had like a more substantial conversation about, you know, why. I got like a 1 to 2 minute response, and then, you know, okay, you have any other questions? So we want to move you into the treatment room so we can get moving.
Going. Right. And I would encourage, if anyone has some similar experiences like that, don't be afraid to ask the question, and don't be afraid to ask the question again, to say, I don't really quite understand what it is, because one, there's the medical language, but then two, there's the concept of how treatment decisions are made, and it sounds like you wanted to be a very active member in understanding what you're doing so that you can really see the path forward, as you had mentioned before. So I'd also like to ask, if you were to give a tip or a suggestion to someone who's just been diagnosed and is getting ready to take this task on, what might you offer them as advice or encouragement?
Me or him?
Both of you.
You go first.
Never lose hope. Never lose hope. What I forgot to mention earlier is I did fill out the form. I on the foundation website, I have a mentor, and she sent me, you know, her contact information and everything, and let me know that she's available. Do you want my husband to talk to your husband? Because her husband was the one who's had very similar diagnosis, almost not exact, but pretty darn close. And she said he'd be happy to talk to you. He's cancer-free now. And I'm like, what? And she recommended 2 books, and she said positive mindset and making sure you have hope are so key. And so that's what I keep hanging on. And spiritually, we have a similar belief system, so that is what we count on, that's what we expect. And that's what I think, just never lose hope, and research, read, and just be positive.
Right. I'll back up all of that. What was most impactful to me was immediate, these, knockout punches of shock, depression, all that started setting in. I felt alone, and the more I started networking with my immediate family, my wife, I started feeling all that support, and a lot of it, like you mentioned, that the support comes in from your family right away, and then it kind of goes away. It's not that they don't care anymore, it's just that maybe no news is good news at this time. But what really kind of changed the tide for me was just getting involved and seeing that, okay, one, I'm not alone. One, there's a lot of people kind of setting the standard here. I noticed a lot of folks in my situation who, positive attitude, very involved in what's going on, and very proactive. And those are the types of things that I really admired, and it really had me go a long way. I think just coming here is going to be like a force multiplier for us and sharing this information. But a lot of it is just support, network, meeting new people, and like she said, just finding a way to be like a community and stay positive and move forward. So that was a game changer for me. It was just kind of opening my eyes and realizing that, hey, we could be a team, we could be a community here working towards the same goal, and we're all in the same boat together. And I don't see anybody else getting depressed or crying about it. And let's just have a positive attitude, because that's the best way to move forward.
Great. Thank you guys so much. And I'd like to invite Paul to join us back to do a questions and answers panel where we'll open it up. We've had some questions that came in on the webcast as well as through registration. And of course, Francesca will be moving about the room with the microphone if anyone here would like to ask a question of our panel. So I'd like to start out with a question about the hospice care. Paul, what is the role of a caregiver once a patient has been enrolled in hospice?
So the caregiver's role is to provide any kind of personal care that may be needed. Real common services, maybe help with bathing, help with personal hygiene. Those are probably two of the most common services that a caregiver will provide on a daily basis or, a few times a week. So, yeah, just those are the most basic.
Great. And when would be the right time to start hospice services or start conversations about hospice services?
I think the conversation, my belief is the earlier the better. My background, I have about 20 years of background in the senior care living world, so memory care, assisted living. And I've had conversations with people that at this point don't even have a terminal diagnosis, but they want to know what hospice is and when to look at that. So I don't think it's ever too early for that discussion. As far as when to access the actual care, I think if someone has a terminal diagnosis and they see any kind of either stressors on themselves that maybe can't handle or in their families, that's the time to at least have the conversation and, again, know what's available. Most patients that I talk to and our nurses and everyone talk to wish they would have contacted us a bit earlier. I hate to meet with families in the last couple of weeks or days of their lives. That does happen, which is unfortunate, knowing that the support can be, again, 6 months out. And I think it's important to remember that hospice services are just as much there for the family as they are for the patient, and in some occasions even more so, just for that support. So I think the sooner the better, at least have the discussion. Yes?
My question was, if someone is on total parenteral nutrition or tube feedings, can they still qualify for hospice care?
That's a little bit of it depends. That is considered curative. So in a lot of cases, the answer would be no. Where it gets sticky is if we were to remove or have their feeding tube removed, now the person that's a comfort issue. So that really needs to be looked at a case-by-case basis. There's not a clear-cut line there. It really depends on where that falls, and we present that to Medicare or the insurer, and then they make that decision. So it is a little gray, I'm sorry to say, but it can come into play.
Okay. Any other questions in the room?
So Mark and Alicia, thank you very much for sharing your story. That was really inspiring to hear. Alicia, not to put you on the spot, but you mentioned that your mentor recommended 2 books, and I was wondering if you remember what the title of those were?
One is called The Ripple Effect, and it is by a gentleman who was diagnosed with pancreatic cancer, and he ended up living, I think, for about approximately 10 years. But it's very inspiring, and it's a very short read. The other one is Radical Remissions, I think by Turner is the last name. And she's studying, there are remissions that are happening all the time. We just don't hear about them. And bringing that to the forefront. They're really good books.
Thank you. And for Mark and Alicia, you talked a little bit about tips for surviving, but another question that had come in was about making the most of each day when you're facing something so challenging. What is it that you do to connect back with family?
For me, it's basically just being around Alicia. I try to spend as much time as we can together and do things around the house. As far as my immediate family, my extended family, most of it is just keep them up to date, let them know how my treatment's going, what my schedule is, how I'm feeling this week, what are the side effects. Most of the things that I try to log down on my journal, I try to share with them because I think it's important for them to know and be acquainted with the journey as well, just so that they can feel included. And I know they're all praying for me, and I think at least they deserve to be informed of how everything's progressing, and whatever the short-term view is of what can be expected. But to just kind of quick message here or a phone call goes a long way to just kind of fortify that support system, which is super important, because I was seriously in a dark tunnel at one point, and then family started reaching out, and maybe others that I hadn't heard of on a regular basis all of a sudden were sending encouraging words. And one that sticks out in my mind is I have a lot of friends that I keep in touch with from high school. We had a really memorable time because we were state champions, first ever for our high school football team. And so one of the guys that I hadn't talked to in decades, right? I guess he heard from one of my other close friends that about my situation, and he wrote to me, and what he wrote to me was all in football terminology. He said, make sure you put your chin strap on, you fight this, you're gonna make it. And those kind of things went a long way. It puts me in the warrior mode and lets me know that there's hope. And sometimes you don't know how your small words impact somebody that's in a dark place at the moment, and that's exactly what happened. So I really appreciated that, and I try to make sure that I keep in contact with them.
And actually in that line, it seems to almost always come up with our patient panels is how do you make that communication happen between you and your loved ones and maybe extended family and friends? Some people have a phone tree or an online blog or something. What have you enacted to communicate about how you're doing and what's going on?
Facebook, not to give them a plug, but either group chats with extended family. It's mainly it's his cousins that I communicate with. We have our own personal immediate family chat that we are constantly either sending silly little gifts or something, just something that can brighten or bring a laugh, or because he's all about laughing. So that's usually one of the big things. And I try to give weekly or biweekly updates to the family chat, the larger family chat, just so they have an idea of what's going on. They'll send one-offs, and I let him know that so-and-so's asking about him. It's opened up lines of communication with family members that we used to just see them when we'd go home. And now he's getting phone calls and he's getting text messages, and it's wonderful. And he's looking at, once he's retired, he's got plans to do road trips, or has some big events that he's looking forward to with other family members, so we can make those future plans.
Thank you. And Paul, is there any systems in place for communication once a family has entered into hospice in terms of where they are, what stages they're in, and that sort of thing in terms of communication? Or is it strictly to the immediate family who's seeking services?
It's strictly to the patient and immediate family, then they can, share that information. Facebook is something we commonly see used. It's a great platform for that. But yes, so obviously all the healthcare workers are kept in communication, and then the patient and immediate family.
Thank you. Are there any questions in the room? Okay, so I think what we'll go ahead and do is we will wrap up the panel. I'd like to, again, thank each of you for being here. We appreciate you sharing your knowledge as well as your personal experiences, and I know that's meaningful to everyone who's here and watching online today, and as we get this launched onto our website in the future. So thank you for being with us.
Thank you for the opportunity.
Thank you very much.